From the Rutgers Cancer Institute, I'm Scott Gurian here with another episode of Cancer Chronicles, Journeys of Resilience, Tenacity, and Hope. If you've been listening to our podcast series, you know that cancer is the second leading cause of death, but it's a scary topic that many people don't like to talk about. So the Cancer Institute, New Jersey's only National Cancer Institute designated comprehensive cancer center, is trying to change that. Last fall, they organized a series of storytelling workshops, culminating in a public story slam event. On each episode of this show, we're featuring another one of the participants from that story slam, and today we have Raven Prophet, who's a data analyst at the Rutgers Cancer Institute. Raven told her story before a live audience about how a visit to the doctor led her to make some major changes in her life.
One day, I woke up, walked into the bathroom, and looked in the mirror. And I didn't recognize the person that was staring back at me. My eyes were sunken in. My hair was falling out in clumps into my hand. I had lost a lot of weight. I was tired and fatigued. And I realized that I wasn't taking good care of myself. I had been neglecting my self-care for a while. I was working at New York State at the time, and I was also a double major in women's studies and human biology. And I was volunteering at a hospital at night as part of a graduation requirement. I had to fulfill 150 hours. In addition to all of those things, I also noticed something else. I had 2 lumps on the right and left side of my chest, a little bit smaller than a pea, and they were moving. And it brought me back to when I was 7 years old and my grandmother was diagnosed with stage 4 breast cancer. Her name was Eula. And her nickname for me was Little Eula because I had her attitude. In her last days, she only trusted a few people to care for her. I was one of those people. And I literally watched her through her entire journey. And she would talk about, her experience with the healthcare field and doctors. And she talked about certain negative experiences that she had while giving birth. And, she expressed this distrust in the medical system. And while I was walking through this journey with her, it started with just a walk to the bathtub, helping her bathe and assisting her in that process. And then several weeks later, I was wheeling her to the bathtub in a wheelchair. Fast forward several weeks later, a few weeks before she passed away, we were carrying her. And I realized at that moment that I didn't want that to be my story. I wanted to take certain precautions and do certain things to prevent that from being my outcome, and also potentially my daughter's. And at that moment, I chose to take autonomy and take control over my own life and journey. And I pulled into the hospital parking lot that day, and instead of doing things as usual and going about my day, I decided to go and get screened, schedule an appointment with my doctor. During that appointment with my primary care physician, we did a couple things. And the appointment was only supposed to be 15 minutes. And she took her time, and we spent an hour talking. And she collected my family history, my social history, and we also did a family pedigree. And while we were drawing that family pedigree, we noticed that breast cancer had impacted every single generation of my family. Not only that, my grandmother had 9 children, and 6 out of 9 children actually died from cancer-related deaths. After that appointment, she recommended that I go and get genetic screening done. And I said, absolutely. And coincidentally, the oncologist who performed the genetic screening actually worked in the lobby of the hospital where I was volunteering at, so I could just sneak in and go and talk to her. And that's exactly what I did. And during that visit, she shared a couple things with me, including her own personal story. She told me that her sister also tested positive for BRCA2, and that her sister was a healthcare worker. And she said oftentimes people who are pre-med students and people who are healthcare workers, we tend to put all of this energy into caring for other people, but sometimes we neglect our own health. And she said to me, my sister finally got screened and started going to her annual mammogram appointments at age 34 and passed away within a year at age 35. And she said, Raven, you have to stop putting it off and prioritize your health. And I did just that. She told me that there were certain measures I can take, including taking prophylactic tamoxifen or having a double mastectomy after I have children. And she also talked about going to get screened for annual mammograms and low-dose CT scans. And that's exactly what I did. I started to take agency over my own medical journey and my own health. And at that moment, I was able to change not just my outcomes, but the outcomes of my entire family and potentially my future daughters as well, because this is a gene that literally impacts every single generation. I can save my life, I can save my child's life, and we don't have to wait until the last minute. We can find doctors who will actually listen to us and hear our story and not just rush us through a 15-minute visit, but actually spend an hour with us. There are doctors out there that actually care.
So, Raven, thanks so much for joining me. I want to start off by asking you to share a bit more about the BRCA gene mutation that you mentioned in your story. For listeners who might not know, explain what that is and its significance.
Yeah, so BRCA, everyone has it, but just in certain people who have like an increased or hereditary risk of breast cancer, that gene is mutated, so it just goes unregulated. And with that mutation, it could put you at an increased risk for not just breast cancer, but other cancers as well. Not just in women, but in men too.
You spoke of how you felt that you were breaking the generational curse of people in your family who were historically fearful of doctors and of the healthcare system. Tell me a little bit more about that and how hard it was to break out of that cycle, even though you yourself were studying to enter the medical field.
Yeah, I would listen to their stories about their encounters with doctors, and it was never good. It was always, they weren't being listened to, they weren't being heard, certain details weren't being collected. They were being rushed through their appointments, and it was just heartbreaking. And I always contemplated about, what would I do if I was in that situation, and how would I navigate those circumstances a lot differently to, kind of improve my own outcomes, So I thought about, okay, maybe I can actually pick my own doctors to go to. Maybe I can, shop around and see, who listens to me, who resonates with me the most. Who listens to my story, because I think that that's a huge part of it, listening to social history and collecting that information about family history to even be able to say, I would recommend that you get screened.
I find it interesting that you ended up going into your current line of work despite these negative impressions of the healthcare system that your relatives had passed down to you. I mean, you're not exactly a doctor or nurse, but it's still a related profession. So I'm wondering, did hearing the sorts of stories you heard motivate you to want to change things?
Yeah, it's not seeing myself and the people that was serving my family and also serving me. I knew what the challenges were for African Americans specifically when accessing screening for cancer. I know that there's disparities around African Americans going for genetic testing and screening in general. So I think that when you see somebody that looks like you and somebody who has similar experiences, you can connect with them on a deeper level. It's okay, you understand, you've been where I've been, you've walked in my shoes or had similar experiences, and maybe you can help me along this journey.
And as you said, so many doctors nowadays tend to kind of rush their patients in and out of appointments. They don't really take the time to listen deeply or explain things thoroughly. But you told the story of this one doctor you visited who was supposed to meet with you for 15 minutes and ended up spending an entire hour. And that seemed to make a big difference in how you approach things going forward. So how has that experience impacted you and your work in this field?
It makes me want to listen to people more, just listen more in general, listen to their stories and think through how we can better serve people, not at a population level, but at an individual level, a person level kind of thing. Because everyone has unique experiences. So not just putting people in a box, but asking the right questions based on what they tell you, but listening first. And that's exactly what she did with me. Her attitude, her approach, the way she explained things, everything, it was perfect.
Raven Profit is a data analyst at the Rutgers Cancer Institute. Cancer Chronicles is a project of the Rutgers Cancer Institute through a cross-department collaboration between the Cancer Health Equity Center of Excellence, the Office of Diversity, Equity, and Inclusion, and Cancer Research, Education, and Training. To learn more about the Cancer Institute's work, visit them on the web at cinj.org. This podcast series was produced by me, Scott Gurian, and the executive producers were Dan Swern and John Keller of Collab Arts, which engages artists, social advocates, and communities to create transformative new work. Our theme music was composed by Dave Seaman. Until next time, thanks for listening.